Hi guys, how are you doing? Welcome to All Around Health Talk. Today we're going to be showing you a video on how to do the antigen COVID-19 test. Obviously, we all know that there is a rapid test which we have shown in one of our videos, but there's also the antigen test, and then there's the PCR which we've also talked about. Now, the rapid test, like we've said before, shows the presence of antibodies from the virus, while the antigen rapid test shows the presence of protein materials of the virus in the nasal swab. So basically, you take a sample from the nose and you carry out the testing, which we'll be showing you in a bit, and we'll be explaining the whole process to you. Okay, now obviously the antigen test is way more effective than the rapid test. It takes 15 minutes for the results to be out, and it's much more effective than the rapid test, but less effective than the PCR, which for now is the gold standard for diagnosing COVID-19. Remember always that to diagnose COVID-19 you would need symptoms, clinical presentation, and a COVID test, which is the PCR that comes out positive. So stay tuned so you can see how to carry out the antigen COVID-19 test. So guys, once you have your gown, your gloves, and your double mask ready, go ahead and introduce the nasal swab into the patient's nasal cavity. Sorry, I had my hand over the patient's head, so you couldn't see the process of introducing the nasal swab, but you'll be seeing it in a bit. So we're going to go straight ahead and put in the nasal swab into the nasal cavity, not upwards, not downward, just straight. You're going to get to a point where you're going to feel some resistance, and at that point you stop introducing and just turn the nasal swab 5 times to get enough sample. Now that sample we've gotten in the nasal swab, we are introducing it into this container. This container has a liquid reagent, so we're putting the nasal swab into this liquid so that we can absorb the sample that we've collected from the nasal cavity. Once that is done, we're going to keep the nasal swab and then get the top. There is a top for that container. We're going to place that top. That top has a hole that makes it possible for the liquid to come out in drops. So now we're going to place 3 drops of this liquid mixed with the sample we've gotten from the nasal cavity in the cassette, just like we do with the blood from the rapid test. After placing 3 drops of this sample mixed with the liquid, there is a transparent paper-like stuff that you're going to use to cover the cassette to make sure that the sample doesn't get contaminated. Right now we're just going to wait 15 minutes for the results to be out, and we're going to ask some questions to our patient. At this point, I'm asking the patient how the process was for him. He said it was uncomfortable but not painful. He had the feeling of sneezing, and it was very uncomfortable for him. Now I'm asking him if he prefers the nasal swab or the blood sample from the finger, and he obviously prefers taking the blood sample from the finger. So we're still waiting for the results. In 15 minutes we're going to be interpreting the results. And yes, I'm goofy like that. Okay guys, now let's talk about the interpretation of this result for the antigen testing. Well, here is the test we did a while ago in this video. If you can see clearly, the date is written, the name of the patient is written. It's very important so that you don't mix up the test kits. Now there are 2 ways to interpret this result, which is different from the rapid antibody testing, which has 3 possible lines. In this case we have a C and a T. Now the C is the control. As usual, it shows that the test is functioning, that the sample that was taken is adequate, and that it is a correct test, right? Now in this case, if the T is marked, it means that it is positive for COVID-19 antigens, and if it's negative, it means that the antigens are not present in the nasopharynx, which is where we took the sample from. Now, it's important for us to know that the antigen test shows the presence of the certain proteins of the virus, right? The PCR shows genetic properties of the virus, and the rapid antibody test just shows us antibodies. So obviously, this antigen test is way more effective than the rapid antibody test. This antigen test also is a test that gives you results within 15 minutes of carrying out the test. It has a 96% sensitivity and a 99.6% specificity, which means that there's also a possibility of a false negative. So when the T is not marked, it means it's negative, but you would also have to look at the patient's clinical history, symptoms, and physical examination for you to decide if you should do a PCR to have a proper confirmation. Still, the PCR is the gold standard in terms of COVID-19. So this is just a video to show you how to do the test, but clinical history is super important. Physical examination is super important of the patient for you to actually have an adequate result. Well, you know what to do. If you like this video, then give us a thumbs up, subscribe to our channel, and follow us on our Instagram at All Around Health Talk. Also share this video to your friends and leave a comment or a question if there is something you do not understand. Thank you for watching, and see you next week.